In 2015-2016, the NHIA realized that membership of the scheme was stagnating, and the challenge was in the renewal of membership. Having a biometric card meant that our members had to go back to our district offices to renew, and with the best will in the world, there was only so many renewals a day that could be done. And the decision was, what can we do differently around the renewal process? The previous CEO, Mr. Nathaniel Otu, explored partnerships with various organizations to see how this could be done. And ILO came forward to partner with NHIA to really work out if there was a way to change the enrollment process. The project started in May 2017 using design thinking methodology, where you come up with some ideas, throw it to the users, get their feedback, and redefine until you come up with a system that is suitable for all. Within a few short months, it was clear that the best way was using mobile technology. And once we decided on that, I think within 6 months, we were already piloting at a couple of districts. And the feedback from members is what refined the process until we had a project. So although it was supposed to be 2 years, we were piloting within about 6-7 months, and we launched within 18 months because we had a good product. For me, it's been an absolute game changer. What started out as just renewal spawned various other things. We weren't stamping on the back of the card anymore. We had to think of an authentication method for providers. The public made it clear they wanted to be part of the accountability of running the scheme. Therefore, they wanted a feedback from the authentication process. So it ended up spawning so many other things. The mobile authentication process meant that now we have real-time utilization data. This is pretty much unheard of in a lot of countries. So what started off as just a mobile renewal project or a renewal project has ended up spawning several other offshoots, which have all been so beneficial to us. The uptake has been very fast just because the product is so good. When something is good, it sells itself. Within 3 months of launching the authentication, 95-96% of providers were compliant without enforcing anything, which again told us it was very good. And the methodology is so simple, *929#, and you're good to go. And this is going to spawn even using the same method for those with the Ghana card to also access health insurance. So what started off as quite a simple project has just expanded into something that is going to affect all Ghanaians, complete game changer. And the important point is the bulk of the work was done by our own staff. The project team was in-house. They are running and maintaining it, and it's so exciting to see that something so important, something so impactful has been completely Ghanaian owned, managed, maintained. Absolute game changer. I think for me, initially, I think a lot of people didn't believe that this project was important. And even I was a little bit of a skeptic, but I quickly realized the importance, and I think my role was to convince everybody around me that this was something that would be a game changer, and we should persevere and really market it properly. It was important I gave the team, the project team, the encouragement at the early stages, and backed them all the way. Every time they came up with a new idea, a new plan, a change, they needed to go into the field. But the work was really done by the project team, and the enthusiasm with which the whole NHIE, once they understood it, took it up across the districts, the corporate affairs team moving around, really enlightening NHIE staff, and then the NHIE staff enlightening the community. It happened so quickly and so enthusiastically. So I think my role was to spark that enthusiasm and interest and push and give that leadership guidance. But the staff of the NHI have been wonderful for this project. I think for the members, a group that is so neglected in health insurance schemes in Africa is the informal sector. Within 9 months, our informal sector percentage has grown from 28% to 35%. The evidence is clear. So the impact is being able to reach an oft-neglected group of people within Africa's social health insurance. They are the ones who cannot afford to sit queuing for a whole day. That's a whole day's income lost. For the providers, they have a surefire authentication method of authenticating the active membership of clients to make sure that their claims will not be rejected. One of the issues that were beginning to crop up was we have electronic method of validating claims, and so if you bring a claim and the person is not active, your claim doesn't get paid. We have given them a way of authenticating every member before they send the claim to make sure that the claim will be accepted by NHIE. For NHIE, we now have another arm. One, we are able to increase membership. The cost of renewal the old way has been taken away, and we're making great savings on ribbons, printers. It has freed up our district office staff to move into the field. So most afternoons you find our staff with registration kits at markets, at businesses, in churches and mosques, renewing registrations or registering new people, educating the public. They have more time to do the work in the community that we envisaged they would do at the start of the scheme. For NHIE staff, it also gives us another arm in our perennial battle on health insurance fraud and abuse. The public have been very responsive, and they have come to us with stories of getting a message that somebody is claiming in their name when they haven't been to a facility for up to 2 years. So all this it has made our work a lot easier. Having the mobile renewal and authentication project, it has drawn us closer to the community because our staff are in there. It has allowed us to have better collaboration with our providers because we've given them the tools to authenticate and submit genuine claims. So, massive game changer.